Hey everyone, and welcome back to the channel. Today, we're diving into a developing public health situation in Ethiopia that's drawing international attention. Health authorities that are currently on high alert, investigating a number of suspected cases of viral hemorrhagic fever in the country's South Ethiopia region. This is a serious situation, and both local and international teams are moving quickly to understand and contain it. So, what exactly is happening on the ground? As of now, 8 suspected cases have been reported. It's crucial to emphasize the word suspected here. Laboratory tests are currently underway at the Ethiopia Public Health Institute, which is the main national lab, to figure out the exact cause of the illness. This testing process is vital because viral hemorrhagic fevers are not just one single disease. They're a group of illnesses caused by several different types of viruses. You've probably heard of some of them before, like Ebola and Marburg virus disease. Others in this group include Lassa fever and Crimean Congo hemorrhagic fever. While they are caused by different viruses, they share some common initial symptoms. Typically, someone who has contracted one of these fevers might experience a sudden high fever, extreme fatigue, dizziness, muscle aches, and a general feeling of weakness. As the illness progresses, more severe symptoms can develop, which can unfortunately lead to a high fatality rate. That's why a rapid response is so incredibly important. In situations like this, the first step is always immediate notification. The rule for public health officials is that any case, even a single one, that looks like an acute viral hemorrhagic fever must be reported right away. You don't wait for lab confirmation to start taking action because every hour counts when it comes to preventing a wider outbreak. And that's exactly what we're seeing in Ethiopia. The national health authorities are leading the charge, and they're not alone. The World Health Organization, or WHO, has stepped in to provide significant support. This is a standard and very effective part of global health security. When a potential outbreak occurs, the WHO has systems in place to quickly deploy resources and expertise. In this case, the WHO is sending an initial team of responders to the affected region. This isn't just 1 or 2 people. It's a multidisciplinary team of 11 technical experts. These are seasoned professionals who have experience with these kinds of outbreaks. Their roles cover a wide range of critical areas. Some will focus on strengthening disease surveillance, which means helping local teams find and track new cases more effectively. Others will work on the investigation itself, trying to trace the source of the infection and understand how it's spreading. This team also includes experts in laboratory testing to support the work being done at the Ethiopia Public Health Institute. Then there are specialists in infection prevention and control, or IPC. Their job is to make sure that healthcare workers are protected and that the infection doesn't spread within clinics and hospitals. This is one of the most critical aspects of controlling a hemorrhagic fever outbreak. Furthermore, the WHO team includes experts in clinical care who can advise on the best ways to treat patients and manage their symptoms. There's also someone to help with overall outbreak response coordination, ensuring all the different parts of the response are working together smoothly. Finally, and this is a huge one, there are experts in community engagement. Building trust with the local community is essential. People need to understand what's happening, how to protect themselves, and why certain public health measures are necessary. Without community buy-in, any response effort is likely to fail. Beyond just sending people, the WHO is also delivering essential medical supplies. This includes things like personal protective equipment, or PPE, for health workers. We all became familiar with PPE during the recent global pandemic. And for frontline workers dealing with hemorrhagic fevers, it is an absolute lifeline. The supplies also include other infection prevention materials and even a rapidly deployable isolation tent. This tent can act as a temporary ward to bolster the local capacity for clinical care, allowing patients to be isolated and treated safely without overwhelming existing health facilities. The WHO is also mobilizing additional technical capacity to support the overall response, meaning more help could be on the way if needed. To get all of this moving immediately, the WHO has released $300 from its contingency fund for emergencies. This fund is specifically designed for situations like this, allowing the organization to provide immediate financial support to national authorities without having to wait for other funding sources to come through. It's all about speed and efficiency. Let's take a moment to understand why these fevers are taken so seriously. Viral hemorrhagic fevers can spread from person to person through direct contact with the blood, secretions, organs, or other bodily fluids of infected people. They can also spread through contact with surfaces and materials like bedding and clothing that are contaminated with these fluids. This is why strict infection control practices are paramount in healthcare settings and in the community. The specific virus causing this particular cluster of illnesses in Ethiopia is still unknown. The lab results will be the key to unlocking that mystery. Once the virus is identified, the response can become even more targeted. For example, the transmission patterns and the most effective treatment strategies can vary between Marburg, Ebola, and Crimean Congo hemorrhagic fever. Knowing exactly what they are dealing with will allow health officials to tailor their public health messaging, their clinical guidelines, and their control measures. The work being done by the Ethiopian health authorities in partnership with the WHO is a powerful example of global health collaboration in action. The local expertise of the Ethiopian Public Health Institute is being supplemented by the global experience and resources of the WHO. This combined effort gives the region the best possible chance of containing this potential outbreak quickly and effectively. It's also a reminder of the constant vigilance required in public health. Outbreaks can happen anywhere, at any time. The key to preventing a small cluster of cases from becoming a large-scale epidemic is a strong surveillance system that can detect threats early and a robust response mechanism that can be activated at a moment's notice. We will continue to follow this story as it develops. The next major piece of information will be the results from the laboratory testing. Once the specific virus is identified, we'll have a much clearer picture of the situation and the specific risks involved. For now, the focus is on supporting the responders on the ground, caring for the patients, and preventing any further transmission. It is moments like these that highlight the incredible work of healthcare professionals and public health experts around the world who dedicate their lives to keeping us safe. We wish them the very best in their efforts in the South Ethiopia region. That's all the information we have for now. Thanks for tuning in to get the details on this important developing story. If you found this video informative, please give it a thumbs up and consider subscribing to the channel for more updates on global health and science. Stay safe, and we'll see you in the next one.